So this is our laser sight machine. So for maintenance, a lot of the time at the end of the day, we'll check to make sure that there are no tubes in here, leftover blood. This is the waste bottle, so we'll dump this out somewhere in one of the sinks when we get an alert on the machine that it's full. This is our sheath reagent, so we'll fill that up. Usually whenever we run out of our tubes, that kind of lets us know that it's time for a new one. So we have that under here. We'll keep a box of different health sheath reagents, and we'll refill that whenever we're done. So for our ELISA test, we're going to be doing a SNAP 40X that tests for the heartworms and the 5 tick-borne diseases. This is blood that we drew earlier. We are just going to centrifuge it in here. We'll do it for about 5 minutes. It usually only needs a minute or less. So we'll wait till that's done spinning. So the blood was done centrifuging, so we are going to put 4 drops of our conjugate into this little tube. And then we're going to put 3 drops of the blood into it after. I'm going to gently roll it. I don't want any cells to burst, so I'm not going to shake it. Then I'm going to pour it into this. This is the SNAP test, so we are going to wait until this is past this line right here, and then we'll snap it down. Once it's snapped, I'm going to run the test, and I'll start the timer to let me know that I have 8 minutes until the test results will be ready. So our ELISA tests results are ready to be read. So I'll click on this to enter the results. It'll bring me a list of different things to choose from. So this is what hers is showing. So that looks like it's going to be negative. So I'll click that, click OK, and then the results are automatically entered into our system. For this next one, I'm going to do a fecal flotation, so I'm just going to mix up the fecal sample that I have in here. I'm going to push this down here. I'm going to fill the rest of it up with the fecal solution. I'm going to turn this until a meniscus forms at the top, and then I'm going to place my slide on and wait about 10 and 15 minutes to read it. So I'm going to do a fecal flotation through the centrifuge, so I'm going to repeat all the same steps, mix up the fecal, place this into it, and then I'm going to fill the rest of the fecal solution up to this point. I'm just going to place this and this in here into the centrifuge. I'm going to remove anything else left in here. And then I'm going to place it onto the fecal setting and spin it for about 10 minutes. So after it's done in the centrifuge, I'm going to set it up here next to the microscope to be waiting to read. I'm going to fill the water, fill this up to the meniscus. And then I'm going to sit it and let it wait for about 10-15 minutes to read. So I'm going to mix several drops of saline and an equal amount of feces on this slide for my direct smear. So I'm going to mix it together until it's just about the same. I'm going to remove some of these larger pieces off. I'm going to smear the slide into a more thin film so that it's thin enough to read through. And then I'm going to remove any other larger pieces. And I'm going to place my slide, my cover slip over the smear. And then I'm going to go read it under the microscope. So I'm looking at my direct smear under the slide for any kind of parasites or eggs. I'll look through the whole smear. Usually go slowly up and down from left to right. And there looks to be like there is no parasites seen on this smear. So for my sedimentation, I'm going to use a tongue depressor here and mix about 2 grams of feces with tap water into this cup, since we do not have a beaker at the moment. After that, I'm going to strain the mixture through this gauze sponge into my centrifuge tube. So I'm going to centrifuge this for about 5 minutes, and then I'm going to read it. So I'm going to use this pipette and get the top layer of the sediment out without disturbing the bottom layer. Then I'm going to use my pipette and get a top layer of the sediment and transfer it into the microscope slide. Then I'm going to apply a cover slip and examine for parasites. Okay, that's it. I'm going to get an ear swab from this patient for an ear cytology. I'm just going to grab this Q-tip and stick it into the ear canal. And get my sample. I'm going to gently roll my ear collection onto the slide. Okay. Now I'm going to stain my ear sample into this Diff Quick solution, like I did with the vaginal cytology. And then I'm going to rinse off the back of it just to get all the excess stain off. And then I'm going to let it dry, and then I'll read it. So here I'm looking at my ear swab sample underneath the microscope. Usually I'm looking for any bacteria or yeast. You'll notice some rods. There is no yeast seen here, but there is some bacteria. Okay. So here I'm going to do a test for the fungal and dermatologic sample. So I'm going to grab this piece of tape onto the affected area that's red right here. And then I'm going to place it on my slide right here. So for my fungal testing sample, I'm looking for yeast. We can even look for things like scabies and different kinds of mites on the sample as well. I am seeing a little bit of yeast. They're almost footprint shaped. There is some bacteria, a couple more clusters of yeast, but no signs of any kinds of mites. So now I'm going to be doing a skin scraping. I'm going to place some mineral oil on my slide and some mineral oil on my blade, and I'm going to scrape the skin just until it starts to get red, because that indicates that I've gotten deep enough. I'm going to pinch some skin here, and I'm just going to scrape. Okay, there. Dip my blade into the mineral oil on my slide to get all of the substance that I removed. Okay. So now I'm going to look at my slide underneath the microscope. I'm mainly looking for things like mites, like mange, scabies, and any type of fungal infections as well, because my patient has been losing some hair and has been itchy and a little flaky, so you just want to rule out any kind of mites or infection. And from this sample that I've gotten, I'm not seeing any indications of any kinds of mites or fungal infection. Before getting started on our necropsy, we're going to want to wear some protective gear. So we'll have a gown that we'll wear that covers our whole body. We'll have a face mask to wear, and then as well as gloves.
Alright, let me have the scissor over there. So we're opening up the abdomen, and we're going to open up the chest as well. Don't know it's big. So this is subcutaneous fat. Let's open up a little bit more. So this is spleen. This dog died of lymphoma. So you have your histopatch, right?
Mm-hmm.
And these are probably all little spots of lymphoma. Won't know for sure until histopath. This is omentum. This is the stomach, which you got to eat a breakfast. There's lots of food in that. Again, omentum. Small intestine. Normal amounts of gas in here. This is colon. So you can follow the colon all the way around. Goes to the cecum. And wow, that is a gigantic mesenteric lymph node. More evidence of lymphoma. This whole thing, that's massive. It should be about that big. because here's cecum. And then it goes to everything's a little bit. Wow, these are huge. So then it goes to ileum and jejunum. So you can follow the whole loop of bowel all the way down to here, which then is the duodenum. Which does not feel normal at all. And that goes up into the stomach. I mean, look at that. Here's pancreas. Here's the right kidney, if you can see that. There's a big old vena cava. And then here's your left kidney. And bladder is empty because it went all over Caitlin. Right here, teeny tiny bladder. So that's everything besides the liver right here. Just I can't open it now. You alright, Rebecca?
Mm-hmm.
I'm not gonna pass out on top of me here.
Mm-mm.
Or throw up on my head. So really that's probably good enough. Okay, so here's your diaphragm. It's that layer of muscle. So now we got better access to the liver, which is big, rounded, from lymphoma. And then here's our heart. And here's our lungs. The lungs are just the coolest thing. It's like a sponge. Lungs don't look bad. So that's your heart. Opens the pericardial sac. And amazingly, not seeing obvious changes in lymph nodes there. Alright, you want your biopsy?
Yeah.
So we'll take a sample of liver. And then sample is spleen. That's it.
Hello. So here we have the biopsy jars, we have the name of the patient, the date that we collected the sample from, the name of the sample that we collected, and the doctor's name on here as well as their date of birth. Just kind of a close-up. So with rabies suspect handling, it's best if only one person handles the dog, and most likely that would be the veterinarian. You'll want to wear protective eyewear, face mask, gloves, a gown. You'll want to submit the brain or the head with the brain intact inside the skull. It has to be overnighted, sent on ice, double bagged with newspaper as an absorbent. You'll want the remainder of the body to be cremated. Okay. So I am now going to take my sample that I took to use for my vaginal cytology, and I am just going to smear it onto my slide. I'm just going to gently roll it onto here so that I can get everything off of the cotton swab. I'm going to now stain my sample for my vaginal cytology into this Quick solution. Once I'm done staining my sample, I'll just kind of rinse off the excess stain that I have on here, and then I'll just let it dry. So right now I'm looking at my vaginal cytology under the microscope. I see some parabasal cells that are kind of smeared. I'm seeing clusters of neutrophils and a couple red blood cells. So I'm going to discuss the 4 stages of estrus. So the first one is anestrus. There's no behavioral signs for it. The cervix is closed, the reproductive system is at rest. Under the microscope, you'll see intermediate and parabasal cells, but you will not see any superficial cells. The next stage of estrus is proestrus. This lasts about 9 days. The males will be attracted to the females, but the females will not accept them. There increase in estrogen and also an enlargement in their uterus. Under the microscope, you will see red blood cells, neutrophils, and some bacteria. The next stage is estrus. This lasts about 4 to 13 days. Estrogen decreases, but progesterone increases. There's also ovulation occurring during this stage. Under the microscope, there are no other cell scenes besides superficial cells that have gone through cornification. You can also see bacteria attached to some of these cells. The last stage is diestrus. This may last up to 2 to 3 months, and the female is no longer receptive to the male. Under the microscope, diestrus and anestrus are hard to differentiate, and superficial cells are no longer appearing, but intermediate and probasal cells start to reappear. I'm going to be doing my cross-matching, so I drew blood from the animal being tested and the recipient. I placed them both into serum separator tubes. Now I'm going to centrifuge the clotted blood samples, and then I'll place the serum into plain red top tubes. So first I'm going to spin the clotted samples. Okay. Next I'm going to centrifuge the EDTA blood sample, and then after that I will decant the plasma from it. Decanting the plasma, I'm going to wash the erythrocytes by placing 1 to 2 drops of blood into a disposable glass tube. Then I'm going to fill the rest of the tube with sodium chloride solution. After that, I'm going to gently mix and centrifuge for 1 minute. Okay, now I'm going to repeat this procedure 2 additional times. The supernatant should be clear and colorless, indicating that the erythrocytes are thoroughly washed. So I'm going to repeat this again by centrifuging it and decanting the supernatant. Okay, so I placed 0.02 mLs of the 2% erythrocyte suspension, and now I'm going to put 0.98 mLs of the saline into a new labeled test tube. So now I place 2 drops of the recipient serum and 2 drops of the donor cell suspension into this new tube, and then I'm going to gently mix it. This is the major cross-match. Tube, I place 2 drops of the donor serum and 2 drops of the recipient's erythrocyte suspension into another test tube, and this is going to be our minor cross-match. So I'm going to examine the supernatant in each tube for hemolysis. I'm going to shake the tubes gently by tapping with a finger to detect gross visibility. Okay. If no visible agglutination is observed, then I'm going to check for microscopic agglutination by transferring a small amount onto a glass slide, and I'm going to examine it under low power. Okay. So no agglutination seems to be present, and this is because all of the erythrocytes are dispersed evenly.